Okay, this video is called Medical Procedures, Best Results, How to Get Them. I'm going to talk about how you get the best results from when you go for a medical procedure. Also, real quick, one of my viewers said to me, "Oh, aren't you offended that Bart criticized you?" No, Bart's a comedian. He doesn't know anything about nutrition. I mean, he recommends as a diet 100% animal foods, no plant foods, no carbohydrates. It's just stupid, okay? It's a joke. So I don't take him seriously in that sense. His bravado and bluster and all that stuff is just a way to compensate for the fact that he's got nothing useful to say. Okay, all right, so getting back to the procedures. So the first question with the procedure is, do you really need to do it? I can tell you probably at least half of medical procedures don't really need to be done. And I think one of the commonest mistakes that patients make is they think that the doctor is trying to help them. And what I'm trying to tell you, and I try to make this point real clearly because I want to help you, you are irrelevant. It doesn't matter. Your doctor doesn't have to care about you at all. There is a standard of care that the doctor is obligated to go by. If you put yourself into a category, the doctor is obligated to go by that standard of care. Anything about you personally is irrelevant. I just tell you that because even if it is not good for you, the doctor is obligated to do it, whether or not it's good for you. Okay, so you need to know that. That's why if you want to get good results, you really should be informed about your own problems. And then people say, well, how could I possibly be informed? Medicine is so complicated. Most of it actually isn't. I mean, don't get me wrong, there are some things that are very complicated. But most of the common stuff is not that complicated. Like, here's a typical question. A patient will ask me, well, do you think I should go for a coronary calcium CT scan, CAT scan? That's what my doctor friends will ask me that. And I'll tell them, no, it's stupid. And they'll say, well, why do you say that? If you used to eat the SAD diet, and almost all of them did, you know you've got atherosclerosis. You know you're going to have coronary artery calcifications, okay? You're in your 50s, you're going to have it. You don't have to check. It's just guaranteed. As William Roberts said, anybody who's eating the SAD diet, meat, oils, processed foods, they're all going to have atherosclerosis. If you feed herbivores high-fat diets, 100% of them get atherosclerosis, okay? Humans are herbivores by their physiology. So because of that, why radiate your chest when you already know the answer? It's not going to change anything. The only way it changes things is I'll see patients who, they don't understand the physiology. They don't understand almost anything. But they see a calcification that's just like, oh my goodness, I have to do something. Usually they do something stupid. They go and they get a coronary artery stent that doesn't help them. But, okay, well, that's the kind of thinking I'd recommend. Another typical question is, should I check my prostate-specific antigen? For any evidence of possible prostate cancer. And I go, well, you could do whatever you want, but what's that going to lead to if it's elevated? They're going to stick 12 needles up your butt to biopsy your prostate, which might make you impotent. Okay, do you really want that? Why not look at the Ornish study where the persons who went vegetarian, they were able to maintain their PSAs or lower them? Why not just go vegan and reduce your estrogenic chemical exposure and dramatically lower your risk? Okay, that changes something. Going for a diagnostic test most of the time doesn't change anything in terms of your health. Changing your diet, your lifestyle, getting your sleep, avoiding caffeine, all these other things, those things make you healthier. Okay, another thing is I see patients, they go for all kinds of biopsies when they've got let's say they got 3 other major diseases that are likely to cause them to die within 5 years. Okay, so they have a very poor long-term prognosis. They should be focused on that, how to recover from that. But instead, they go and they get all these biopsies of things that are almost certainly benign, like some benign appearing thyroid nodule or some other nodule that is almost certainly going to be benign. We don't know for sure, but it probably is. And even if it's cancer, it's going to be a low-grade cancer that they're not going to die from anyways. Let's say a possible prostate cancer with a borderline minimally elevated PSA. Why do anything? Okay? Most people, they die from heart attacks, they die from cancer, they die from strokes, diabetes-related complications and stuff. So what I'm saying is, look at the relative risk. What is likely to have a big effect on you, and why worry about the little stuff? Let's see, going for a colonoscopy. Well, if you're very high risk and there's a problem, or you're actively bleeding or something like that, where, it could maybe save your life. On the other hand, if you're a healthy young walker-talker, your risk of having colon cancer is pretty low, but unless you're symptomatic, and even then, there's things you got to consider. For example, I went for a colonoscopy when I was a young guy in my residency, probably only about 30 years of age, because my mom had metastatic colon cancer. And I remember the gastroenterologist, I didn't know him. He was recommended by some other residents who I didn't really know. He did all this detailed physical exam on me. I'm like, what are you doing, pal? I'm a totally healthy young guy. But I know that he did more detailed physical exam because that way he could bill more for a more thorough physical exam, which was completely irrelevant. I went for one more colonoscopy years later, and I just went with a guy who I knew at that time, who was a friend of mine, and he was known as being great at, gastroenterology, and he didn't even examine me at all. He knew there was nothing wrong with me. He just checked it because I was worried, about the family history of my mother, and I never gone for one since. And what he told me was my colonoscopy was so normal. He said it wasn't even funny. He told me the truth. Okay, and so I just prevented, and other people have had similar experiences. They've had polyps even, and they've gone away once they went low-fat vegan. So why not just go low-fat vegan? For numerous reasons. That's a separate talk. Okay, so always look at the risk-benefit ratio, because lots of times I see patients going for procedures they don't really need, and they sometimes have complications. Why do the procedure if you don't need it? As simple as that sounds, I can guarantee you tons and tons of people go for procedures. I myself, I've done many thousands, I don't know, like 10,000 procedures. I've done so many biopsies, for example. I could do them, half asleep, one eye closed. So ask yourself, is this the most accurate way to obtain this information? Does it have to be something invasive? Is it the safest way? A lot of times there's more than one way to do something. Okay, all patients are very much afraid of the C word. The C word is cancer. If you mention cancer, a patient will do anything. You could get a patient to do things that would be insane if you just tell them it might be cancer. And what they don't understand is not all cancer is alike. I gave a previous lecture where I talked about, is the cancer likely to be, a vulture? Is it likely to be a rabbit? Or is it likely to be a turtle? The point being is a turtle is a cancer that grows so slow, it's highly unlikely to ever cause the patient any symptoms, let alone to die. So why worry about that? Okay, a lot of prostate cancer is like that. A lot of thyroid cancer is like that. Okay, so anyways, just because you hear the word cancer doesn't mean it's a big deal. Same thing with the word aneurysm. I can remember I was doing all these cerebral arteriograms because people were worried about aneurysm, and you're talking about some little miniature aneurysm that was low risk to bleed. So you really want to know the details to make an informed choice. Okay, then what's the proper attitude? Okay, I do a lot of procedures on patients, and they usually say things to me like, oh, I want the most sedation you can give me. I want to be knocked out for this procedure. They don't understand. My way of thinking is exactly the opposite. I would say to myself, I want as little sedation as possible. I don't want to risk with these drugs, these benzodiazepines. Are they going to potentially have a long-term damaging effect on my membrane? No way would I want any of that if I could avoid it. When I went for my colonoscopies, I did them both with nothing, no sedation at all, zero. And I got made fun of by my family for that. Oh, you enjoy it? No, I just don't want any side effects. And that way I could drive myself. I don't need a driver. Okay, so other things a lot of patients do is they keep squirming around and moving when your doctor's trying to do a procedure. In my experience, I think patients tend to think that procedures are all easy and that the doctor's just doing it's a walk in the park, like 2 + 2 = 4. But that's not the reality. A lot of procedures are pretty routine, but there's also a lot of procedures where I'm doing something technically very difficult. Like I'm trying to hit a small little lymph node in their neck, that's right in between the carotid artery and some other important vessel. It's pretty important they don't move, okay? And I'll also be trying to do something difficult, trying to steer through some tiny little narrow area in their spine or something. And, it's not a time for them to be fidgeting and moving around. Like a smart patient, what they should do is ask the doctor this question. How can I, help you to make this procedure go well, for us to get the best possible outcome from this procedure? Because that makes a big difference, You give me a cooperative patient who's not going to move. What I do is imaging guided surgery, and I mostly do neuroradiology now, but what I'm saying is if you're in a general surgery, the patient's under general anesthesia, they're unconscious, okay? They're not going to move. The patient's involvement in the procedure becomes irrelevant in that context. But if you're doing a lot of, imaging-guided surgery, interventional radiology procedures, the patient's fully awake and, has little local anesthetic, but sometimes we'll sedate with, the IV sedation. But the point is, you want to cooperate, position yourself whatever way makes it easier for the doctor, because the same procedure with good positioning and patient cooperation, I could get done, let's say, in 20 minutes, okay? And then if I got a patient squirming all over the place and moving and uncooperative, it could take an hour and a half, 2 hours. So it's important to try to work together to help get a good result and be aware of the nuance. A lot of things, too, you want to be smart about it. Like I've had... like a typical thing a patient will say, this is one of my relatives, one of my cousins, oh, I'm going for surgery on Friday, that way I have the weekend off to recover. and they think that's intelligent. To me, that's incredibly stupid. You would want to go for a procedure on a Monday. That way, if you have a complication or you're in house, the attending physician, who's the best one and knows what's going on, will be there to manage your problem. Okay, you get a surgery on a Friday. The attending, he goes on vacation on the weekend. You're going to be managed on the weekend by a couple of junior interns who don't know anything. So it's good to know what you're getting into before a procedure, but in my own personal experience, I say the most important thing is have a good long talk about why are we doing it? Do we really need to do it? Can we avoid doing it? What do we lose by doing it? And then how can I help? If you're going to decide you're going to do it, how can you help to get a good outcome? Okay, anyways, hope that helps.